Hi guys, I've got Emma here today. We're gonna do our Endolift treatment. I'm so happy because she's such a perfect candidate for it, and we can use the Endolift for both, I would say its best functions, which is skin laxity, skin tightening and fat melting as well. So in her case, for the lower face, we're going to do the Endolift all across for mainly skin tightening. So the fat in the face is very, very precious, because when we get older, we progressively lose the fat. So we want to keep the fat in the face, especially around the marionette lines. We just want to tighten. So the main priority for the gels is just to tighten, and the Endolift is by far the best treatment to deal with non-surgical lower face gels. But at the same time, for the under chin area, the Endolift can work really, really well for fat melting, and actually does both, can do fat melting and skin tightening at the same time. So although it's not a liposuction, so we don't extract the fat cells, however, we go and destroy them with the laser, and then we induce a skin tightening. So we will see a kind of degree of result straight away, but the final result will take time. We're talking about a peak between 6 and 9 months, and the treatment can be repeated, lasts for a couple of years, so that's really good. Okay, let's get started. First step of the Endolift is the numbing, which ironically is also the part that hurts the most. So I inject some lidocaine just so afterwards the laser would be virtually painless. But yeah, it just gives a tiny bit of stinging initially when it gets in, but I'd rather that, so then you can totally relax and be really nice and comfortable during the actual procedure. So Emma is a superstar, doing really, really well. So she's a really good patient. Some patients just feel the sting a little bit, but yeah, it's very, very, very quick, and then the tissues actually get numb quite quickly. So what you see, this red light, is in essence the energy that is going through the laser, through the actual fiber that you've seen before. So I am placing the fiber very carefully just underneath the skin. So what's happening now underneath her skin is a mechanism of instant skin tightening. So there's actually two procedures that are happening inside her skin. It is an instant skin tightening as the energy passes. There's another effect of collagen stimulation that is kicking in as well. So the ideal patients for the Endolift is literally anyone that has a lower face gels. So these area here starting to go a bit lax. So you can either have this treatment done as prevention, which is what I would highly recommend. So you can actually have it done in your late 20s, 30s, as I had as well, or you can have it as a, obviously when you're later on in life, 50, 60, 70, there's no end point really for improving those if they're already noticeable. So the beauty of the Endolift is that it actually goes and treats and improves the quality of the skin, because even if you go, let's say, for surgery, yes, they cut the tissue and they give you a lift, however, nothing will be done in terms of improving the skin quality. So the beauty of this is that it goes and improves the collagen stimulation, so even if later on you go through surgery, you know that your tissues have really the best in the best condition possible. I want to say something else here. So what the Endolift does, it basically glues the skin to the muscle. So it creates almost like a shrinking effect of the lower face. What it doesn't do is lifting the muscle. So obviously to do that, you have to go through deep plane facial surgery. So in her case, we're just going to glue the skin to the muscle, and there is a bit of muscle ptosis. Obviously that can be achieved only surgically. Okay, so I just want to do the pinch test. So we have done half of the face, this side no. So I just want to show you the difference in the skin laxity. So this side treated, I can't really pinch much. This side not treated yet, you can pinch much more. So in this side here, look at the difference. So I've done a combination of skin tightening, a bit of fat melting here. I still need to treat this area here for both as well, but just from this, look at the difference. We call it the pinch test. So as you can tell already, like literally couple of minutes after the treatment is finished, already this is so much tighter, and this is going to improve over the next 6, 9, 12 months as well. Okay, so we literally just finished the Endolift treatment. A few seconds ago, we treated the lower face underneath her chin as well. So as you can tell, immediately after, yes, she has a bit of redness, but obviously she also has rosacea, so it's to be expected. But other than that, you can't even tell where the fiber has gone into her skin, so that's why it doesn't leave any scarring, any marks. She can literally go back to work. Yes, she will have some swelling, of course, but that's exactly how it looks. So very little invasive.